Great morning, Houston, downtown, midtown, third ward, fifth ward, and those of you listening in the car at 102.5 FM. Great morning to you that are tapped in through our free KMAZ app, and great morning to you that are listening on our website at www.amazing1025fm.org. I'm Amanda Sapp here at Amazing, and super excited about being able to bring you guests who are doing amazing things in amazing ways. We've been talking about an upcoming prostate cancer event. It's entitled Face to Face, Shoulder to Shoulder. Let's talk about breast cancer. And I've got a guest here today who is going to share with us a little more in depth about how you can be a part of this event. But before I even get into all of that, let me just share with you who I have in the studio with me today. So please turn your volume all the way up. He is a clinical associate professor at Texas Southern University College of Pharmacy and Health Sciences in Houston. He's also a clinical assistant professor at the University of Texas Health Science Center at Houston McGovern Medical School and a clinical pharmacy specialist at UT Health Memorial Hermann Cancer Center in Houston, Texas. He received his Doctor of Pharmacy degree from Texas Southern University, followed by a fellowship in oncology at the University of Texas MD Anderson Cancer Center in Houston. He's a board-certified oncology pharmacist, is the program director of the T.L. Burks Breast Cancer Outreach Center, and serves as an advisory board member for the Texas Southern University Breast Cancer Screening and Prevention Center, which is funded by the Cancer Prevention and Research Institute of Texas. He would consider himself innovative, resilient, and empathetic. Please welcome into our amazing studios in here with us today, Mr. Rodney Hunter. Great morning.
Thank you. I appreciate it. I appreciate the introduction. It's a little lengthy, man. I should probably cut it or something at some point. But I always get asked for it, so I always just give them the same one. But thank you for introducing me.
With what you're going to be sharing with us today, we needed to hear all of this so people can have a better understanding of the space you're coming from here. Now, we talked about this upcoming prostate cancer event that you are a part of, but before we go even a little further into that, can you tell us just a little bit more about you?
Sure. So I actually graduated from Texas Southern, as you mentioned. Cancer has been very near and dear to my heart. I've been practicing in the world of oncology for the past 16 years, ever since I've been a pharmacist. And so as I've worked with cancer, I've seen some of the disparities with minority patients. And about 6 to 7 years ago, myself with another one of my colleagues at Texas Southern really started trying to figure out how we could impact the community in a positive way. And it grew from starting with breast cancer, no-cost breast cancer screening with mammograms, to now we have a host of different things we're doing at Texas Southern University related to prostate cancer, breast cancer, and just community outreach with health in general. And this prostate cancer event, which is led by Dr. Veronica Adjewole, who's one of my former students and has done great things at Texas Southern University with cancer prevention and screening as well. We're working and just trying to impact our community in a positive way.
Why do you think people don't want to get screened? Is it that they don't want to? What is going on there?
I think as we talk more about prostate cancer today, you'll see that with men, I know that if they have any information about it, they know that they need to get a digital rectal exam, which it's not necessarily something they're super interested in getting, but there are also PSA tests, which are done via like just grabbing some blood, which are a little bit easier and maybe not as invasive for patients to get. But I think that with men specifically, I think the digital rectal exam is a big barrier that we need to talk about and understand that that's a lot. That's the lesser of the two evils when you think about getting prostate cancer and it becoming advanced and metastatic before you start getting treatment. So that's taking you away from your family at an early age.
Do you have an option for either or when it comes to testing?
Well, there's been quite a bit of studies and quite a bit of data with that. There's imaging that could possibly be done. So if an individual is really at the point where they just did not want to get a digital rectal exam, there are other things that could be done, which would at least give them some screening protection, so that if there was something abnormal that came to pass, then we could pick it up. So if digital rectal exam is why you're staying away from getting screened, then that's something to talk to your PCP about. And then there's other places where they've done imaging studies that could possibly be in place of the digital rectal exam, which is much cheaper. So it's a cost situation there too, because the imaging is more expensive than the digital rectal exam.
Now, I know I just mentioned, people might not want to get scanned, but has there been a rise in people getting tested? More so, reason why I ask is because I've seen a lot of people spreading the word, raising awareness about getting tested or about just what it actually is. So have you seen an increase in people taking interest?
I can definitely say that, in the community there's been an increase in people understanding that the conversations need to happen, and that men need to come out and understand that this is a way to protect your family by making sure you take care of your health. I think that when you start, I do a lot of these talks and I do a lot of these outreach events to try to spread the word about prostate cancer. And my continuing message is that if you want to take care of your family appropriately, you need to take care of your health. So taking care of your health is what I think has been sparking like a lot more movement in the community as far as getting screened and becoming aware. Because with breast cancer, there's a huge push in breast cancer, but I think in prostate cancer and with men's health, we're lagging behind and need to get a lot better so that we can protect ourselves too.
How can we advocate for men to go and get tested? How can, our men's counterparts be like, hey, come on, let's go do this right quick? I mean, what do we need to do?
Great. I think one of the biggest things is understanding that, the health of a family member, the health of a brother, a husband, a cousin, a father, all of those things. It's like, I think if you speak to them about time that can be spent, additional time that can be spent, things that can be done if your health is taken care of. Maybe there's another grandchild that shows up that you would get to meet if you take care of your health. And if you don't take care of your health, maybe that grandchild, you'll never meet that grandchild. As a father, you want to walk your daughter down the aisle when she gets married, but not taking care of your health may cause you not to be able to do something like that because you may not be here anymore. So you really have to have those real conversations, because there are definitely things that happen for patients that will shorten their lifespan if they're not taking care of their health appropriately, especially with cancer.
What are some preventative measures that men can take to prevent this?
So a couple of things. The biggest thing, and we have our conversations about prostate cancer and how it affects the African American community. 61% higher chance of developing prostate cancer if you're African American male when you compare yourself to a Caucasian counterpart. So just in general, being African American causes you to need to start screening earlier. You start screening in your mid 40s, when you're even, and that's with no family history if you're an African American male, versus you would be in your 50s if you were any other nationality. So when you talk about prevention, screening early and being aware that just your ethnicity, the color of your skin, is going to actually increase your risk of developing this particular cancer.
That's very interesting. Thank you for sharing that with us today. And you all are going to be talking about this at the upcoming event that you're moderating the face-to-face, shoulder-to-shoulder. Let's talk about prostate cancer. I'm sorry. Yes. Could you talk about your prostate cancer risk group?
Sure. So when you look at the risk groups, of course, like I mentioned, African American males and how they are. That's one group, but there actually is family history is actually important too. So this crosses all ethnicities. Like if you have a first degree relative, you start to double. If you have multiple first degree relatives, you start to increase your chances by 4 times. So the more family members you have that have developed prostate cancer, there's definitely a hereditary link to it. So outside of being African American, you definitely have to watch out for if you a father or a brother or even a son, maybe in rare cases, has had prostate cancer prior to you, then you need to start getting screening earlier if you have that family member. Also, there are some certain types of genetic mutations that can occur that cause patients to have an increased risk of developing prostate cancer, and that's something that can be actually done with the blood test as well. You can get genetic screening that's done. If you have a history of cancer in your family in general, it's always actually a good option to get genetic screening, because there could be a genetic component that increases your risk of developing certain cancers. So the genetic screening and the genetics in general with BRCA mutations and different types of mutations, that can also increase your risk.
Is prostate cancer reversible? Am I saying that? Is
correct?
That
so I think, is prostate cancer is curable?
Curable.
The answer,
okay.
Yeah, no worries. The answer is yes. So prostate cancer is a cancer that, if detected early, has over a 90% cure rate. It's not until you get to the metastatic setting, and metastatic means that it's spread outside of the prostate to another part of the body, that we cannot cure it. The good thing is that the majority of cases that are diagnosed with patients who are diagnosed with prostate cancer, they start out in the place to where we can cure them at the 90%. So really, the patients who will pass away of prostate cancer or have the problems with prostate cancer is because treatment was not sought at an appropriate time, or the treatment was not completed. And those are important things also, because patients will get diagnosed and get a little bit of treatment and then don't continue on and don't finish up, or they will get diagnosed and don't get treatment at all because they're scared over the side effects and things like that. And those are the type of patients that actually lose their life from prostate cancer.
Does what does age play a determinant on life expectancy once diagnosed?
That's a good question. So actually, prostate cancer is such a, we call it indolent because it grows really slow. It's like a very slow growing cancer. So a patient, for instance, is diagnosed with prostate cancer at age 70. There's a chance that we may not even treat that patient. We'll actually analyze their life expectancy before we decide if we're going to put them through all of the treatment that's going to be necessary. Now, patients who are being diagnosed in their 40s or in their 50s, we typically have a life expectancy is going to have them at 30 years or 40 years, or so those patients, we are going to definitely treat them. But if you're a younger patient, then you definitely get treatment. When you're an older patient, because prostate cancer kind of grows slower, there's a conversation like, well, do you really want to get treatment? Because if you're 75 or 76 years old, before this causes any problems, you probably be 90 or 85, or so you of course can get the treatment, but it's got its own set of side effects and things that you have to work through if you are older and you get the treatment.
Are there, if you're older,
Mm-hmm.
With this treatment, I don't know what the is there certain pains that you might experience?
Sure.
What does that even feel like to
Sure.
have?
So a good question. So something that maybe individuals aren't really aware of is that prostate cancer is actually driven by a hormone that circulates in men's bodies. So testosterone drives all of the growth of prostate cancer initially when you're diagnosed. So we're really focused on testosterone whenever patients are diagnosed with prostate cancer. The main treatment is actually to give patients two medications that block the activity of testosterone in the body. You can also do things like surgeries and radiation. So when you talk about surgeries, putting the patient through surgery, they are going to have to go under anesthesia. There's going to be surgical complications or surgical risk complications that may occur. Then that's why you have that conversation with those patients about, do you want to get this treatment, or maybe you only want to do the medication side of treatment, which is the shutting down of the testosterone, to see how that works. But the typical patient, if they're diagnosed early enough, one of the recommendations on the treatment will be to do surgery. So older patients aren't necessarily optimal patients to get surgery sometimes.
Now, what are some of the symptoms of prostate cancer? Like, how do they even know that they might have that?
Sure. So early on, prostate cancer actually appears as a very common problem that men have, which is called BPH, which is enlarged prostate. So in that situation, you start having things like painful urination, or it become your urine is kind of spotty to where you have a stream and then it stops, and you have a stream and then you stop. Or if you're urinating, you have two different streams of urine that are coming out, which would be indicative of there possibly being an obstruction or something in the way, like a mass.
I see what you're saying. Yeah.
Yeah. A lot in worst case scenario, sometimes patients have like blood in their urine that can possibly cause that can possibly be seen on the urination. And then on worst case scenarios where you're really in an advanced stage, you might start having back pains or coughing, things like that. And that's because the cancer is spread outside of the prostate to your lungs or to bones and things like that.
What does treatment look like if it's not surgery?
Sure. So if you don't have surgery and you're being treated for prostate cancer, what you're going to be seeing is either radiation to the prostate area, to the pelvic area, and that has some side effects, but maybe not as much as you would see with a surgical intervention. But the surgical intervention is what definitely, without medications, kind of gets rid of all of the cancer, because if the cancer is not spread, once you remove the prostate, you end up with no source of cancer. So then that's why we say you're cured. The third and the treatment that's used more commonly in the more advanced stages, even in combination with surgery, is those medications. Those medications, there's a tablet and an injection, both of them designed to block the activity of testosterone in the body. They cause all kinds of side effects that we can manage, but they definitely are there to where men are going to talk about them, because it's shutting down all of your testosterone activity in the body at that point to starve out the cancer and get rid of the cancer. And then after that, of course, you can stop and then you regain some of that. But I think what men will most commonly complain about and most commonly have problem with is impotence.
I was just about to
Yeah,
ask. Yeah.
that's what they complain about most commonly, because of course if you decrease the activity of testosterone, it does have a sexual component to it that you do see that effect if you get the hormone directed therapy. And that's why the surgery and the radiation are sometimes preferred if you have the right stage when you start talking about all the side effects with all three treatments.
Can you reverse that? I mean, can
Yeah, you can.
impotency be reversed? I don't know.
It can. It can.
Mhm.
Yeah, it can. So erectile dysfunction, impotency, all of those things can be reversed once the hormones are stopped. Now, patients who have the very advanced prostate cancer that we can't cure, we don't stop the hormones until they don't work anymore. So they're on treatment for the rest of their lives because we can't get rid of the cancer. So we have to give them treatments to try to keep it under control throughout the time that they're under our care. But patients who are diagnosed early, they'll have a period of time if they're on those medications, and then that will actually stop at a point. So it's not a forever situation with the androgen deprivation therapy, which is what that treatment I keep describing. It's got those two medications. It's called.
We could talk. I can ask questions all day, but about this, but we don't have the time. But I
I
know that
understand.
there is an upcoming event happening where if people have questions like I do, then they can come to this event. Tell us where it is.
Sure. So you probably have to. I have to get the flyer
I
out
can pull it up.
to give you the exact address. I don't want you guys
Sure
coming to the
thing.
wrong
That's
address.
right.
Yeah.
So it is September the 16th at Progressive New Hope
Yes.
Church, 3106 Page Street, here in Houston, Texas, from 10 a.m. to 2 p.m. And Mr. Hunter, you're going to be a moderator at this event. Is
I
that
am.
correct?
I am.
And you guys, what can people expect when they come? What other things are going to happen
Sure.
in this
Right.
time?
Right. So our focus is going to be advocacy, awareness, and action. Action because we are going to have actual no cost prostate cancer screening that occurs at the actual event. You can actually join it through Zoom, or you can come in person. So if it's information you seek, you can come and you can just come to the event and go and get it on Zoom. But if you do want to come and possibly get screened, which we definitely promote that, we'll have the ability to screen you for prostate cancer at the event. We'll have a guest speaker. We'll have the session that I'm going to moderate. The one session I'm going to moderate is going to have prostate cancer survivors there, as well as other healthcare professionals like myself. So we're really just trying to really get a lot of information out there about prostate cancer, and we're also trying to give to the community what we received from our blessings at Texas Southern. So we're definitely there to support, give you information, and actually screen you if you deem so necessary. If you come to the event and you have interest, it won't be a cost to you.
I know a lot of y'all will be like, what I don't know won't hurt me,
Well,
but it
that's
will hurt you.
yes. We have to get the information out, and from that information, we have to have action, and from those actions, we'll see the results that we're looking for.
And if something like this does come about once you get tested, there's a support group. Can you quickly tell us a little bit about that?
Sure. So we have the support group that we actually have. Texas Southern University actually has a aggressive prostate cancer screening study that we have done previously and gathered information, and from that has stemmed additional funds that have helped us form things like support groups for prostate cancer patients, prostate cancer survivors, survivorship programs, and with the Prostate Cancer Foundation, even more resources if they are needed. So not only are patients who are just getting screened, we're trying to support them. If you actually are a patient that's battling prostate cancer or is in the survivorship stage of life to where you've been treated and you're needing assistance, we have those resources at Texas Southern as well.
It's good stuff. Face to face, shoulder to shoulder. Let's talk about prostate cancer. It is the prostate cancer event that's happening on September the 16th. They're raising awareness. You can also become an advocate, and you can take action and be a part of the experience. This event is going to be happening at Progressive New Hope Church at 3106 Page Street. You can join them in person or on Zoom. And I'm very excited about you guys doing what you're doing to share this good information. People can also follow them on social media at CECTX Southern U for more information. And we do like to leave fans, followers, listeners, and supporters with something inspiring, something empowering, something they can take with them the rest of the day, the rest of the week, and all the way up to the weekend. Mr. Rodney Hunter, what do you want to leave us with today?
Oh, I think that if I was going to leave you guys on anything today, my specialty being cancer, like it's about taking care of not only yourself but your family members, making sure that you can provide them with the information that they need. Sometimes it's going to possibly save their life and cause you to be able to spend more time with them. So I'd harp on that and gather the information and take that information and help save a life in your family.
Love it. Thank you for being my guest today. Really appreciate you.
I'd like to have. Thank you for having me.
Hey guys, look, be the change you want to see. And if not you, who? If not now, when? And this is the Amanda Sapp Morning Show on Amazing 102.5 FM, your do good through good station where we're changing lives one listener at a time. Until next time, I'm out.